Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and here with me is Chase. Chase, please introduce yourself.
Hi, everyone. My name is Chase Meyers. I use he, him pronouns. I'm currently an administrative fellow at Children's Hospital Los Angeles.
We're so happy to have you with us this evening, or I guess it's a few hours earlier there in Los Angeles. So this afternoon, thank you for cutting out this time out of your day to join us. You have a varied career, a lot of great experience, and you started similar to myself in North Carolina. You went to UNCW there in Wilmington, and then you went to UNC Chapel Hill. And what's interesting about you, as you and me were talking about, is you have an MPH, not an MHA or an MBA. I want to know what led you and what made you make that decision to get that MPH.
Yeah, no, thank you, Cole. I just want to start by saying that I've always had a huge interest in healthcare, especially, being a young child growing up in a very rural environment. I saw a lot of health disparities that existed in my community and going beyond like rural health specifically, health disparities among queer folks. So growing up like as someone who is gay and again, rural North Carolina during the 2000s, it was pretty tough and going and speaking to providers and trying to be open with them and getting the care that I needed. I saw lots of flaws in the system. And so that made me want to pursue psychology and public health in undergrad. So I did my years at undergrad. I was in the honors college there and ended up doing an honors undergraduate thesis. And so I chose to do mine in public health. And I looked at provider barriers to prescribing patients PrEP for HIV protection. So essentially what I did in that paper was a giant landscape assessment, a literature review of all the reasons why providers may not be prescribing PrEP to folks. And for those who don't know, PrEP is pre-exposure prophylaxis. It's supposed to protect you from HIV transmission. And essentially from there, I, again, saw lots of health disparities that existed, looking at folks who are queer and gay. And from there, I just realized that I wanted to continue learning more about how we can better enhance health equity and reduce health disparities across not only those who are sexual orientation minorities, but across all marginalized communities. And so with that, I decided to apply to a few different MPH programs. I ended up going to UNC Chapel Hill for a couple different reasons. If you grew up in North Carolina, you know that UNC is sort of like the big school. Everyone's either a Duke or UNC fan. It's really fun getting to the rivals. But my family grew up really cheering on the Tar Heels, and I felt it kind of in my blood to go to that school. Part two is that they are the number one public health, school, the number one public school of public health in the country. So I thought it'd be a great opportunity to be able to learn from the best and leaders in the field. And then I'd say part three, probably the biggest reason, is because of the degree that I got there. So my MPH was in health equity, social justice, and human rights. And that, again, aligned directly with my interests from childhood through undergrad up until that point when I was applying. So I made the decision to apply to that program. It was the last one I heard back from, thankfully was accepted. And yeah, the rest is history. I was able to move to Chapel Hill and have 2 great years there.
And it's impressive that motivation that you've had because you didn't just witness these things, you've experienced them firsthand. And so I think that's an impressive motivation. Why choose to go into healthcare administration and why not, a PhD or a DRPH, which is, the route a lot of public health individuals take. So what was, that you wanted to do differently?
Yeah, funny enough, I actually wanted to go to medical school eventually. So throughout undergrad, I was pre-medicine. So I did my psychology and public health degrees, but had a preclinical focus. So I made sure I took all those hard bio classes, anatomy, physics, all that fun stuff. And then thought that grad school would be a nice break or segue where I could learn more about, advancing health equity, more public health kind of focus here. And then from there, lead into medical school. Essentially, as soon as I got into the program, I decided that that was not going to be the case anymore. I was like, okay, I'm going to be done with school after these next 2 years. I'm ready to, stop spending money on loans and to actually be making money. So I knew that I wanted to still work in a hospital or a healthcare system. And so I actually was speaking to my friend who was doing their MHA at University of Washington in Seattle. And they told me about healthcare administrative fellowships and essentially how you can kind of be mentored into working for a hospital or a healthcare organization. And the more I looked into it, the more infatuated I became with just kind of like the concept, the way that you're able to work on, projects across the department. You're able to interact with folks in the C-suite and executives that are leading the institution that you're doing the fellowship with. So I feel like all of those factors kind of came together, and I decided that I would start applying to healthcare admin fellowships come my first semester of my second year.
And so when you decided to do that, how many fellowships did you apply to? And then what, fellowships were you looking at? Was it all across the country? Was it in specific areas? What did that look like?
Yeah, so as you noted, born and raised in North Carolina, so I was very much excited to kind of leave the Southeast. I have so much appreciation for that area and for North Carolina, but I knew that I wanted to push myself and go somewhere that was bigger and different. And so I focused on applying to organizations that were in bigger cities, so looking at Chicago and Los Angeles primarily. And from there, really kind of tried to pull up each individual organization and see what it is that their mission, vision, and values kind of focused and centered on. Again, I was a very big proponent and still am of health equity and doing what we can to minimize health disparities. And so that was a huge piece of me researching and looking at fellowships that I would be potentially a good match for. And so I ended up applying to 5 different fellowships, again, kind of looking at the same areas in Los Angeles, Chicago. And then from there, I got 3 interviews and then was able to do final round interviews for those 3 organizations and ultimately ended up getting offered this position here at Children's Hospital Los Angeles.
And congratulations on that. That's a great
Thank you.
accomplishment. What led you to want to apply to Children's Hospital of Los Angeles? What was it that you saw about the organization that was meaningful?
Yeah, I would say probably the biggest piece is just the payer mix that, we have here at the hospital. So about 75% of the kids that we serve are Medicaid patients or Medi-Cal as we call it here in California, and 25% is commercial insurance. So it's not a money-making model by any means, but I think that it just went to show that CHLA is not only, putting the words on their website, like, oh, we're committed to diversity, equity, inclusion, but they're also like walking the walk that comes along with that as well. We are the #1 children's hospital in California. And so I think that you don't really get that or those accolades, without really putting in the work and putting the money where your mouth is, if you will. And so just seeing that, they didn't only have this information listed on the website, but the more folks I talked to, the more I was able to investigate and hear from external folks who worked at the Children's Hospital, I really saw how ingrained they were to helping their community and to giving back to folks. And going beyond that, the community engagement pieces I saw on the website were very touching. I saw that the hospital does a lot of groundwork here in Los Angeles. So tons of different things, especially given the population of Los Angeles. There's a lot of Spanish speaking folks, and to see that they catered to the individual needs of their community just really, really stood out to me. And I knew that I wanted to be a part of that.
That's really nice. And that does kind of tie in with your background as well in public health, and that makes a lot of sense. So, since being there, is it a 1 year fellowship or a 2 year fellowship?
It's 1 year.
So, you're getting close to being done. Then you have, what is it, 3 months or so left?
Yes, yeah, we wrap up around June or July. So, getting a kickstart on that job search.
And how has your experience been, and what did you do? Is it what kind of projects did you work on? What departments did you work in? What has that been like?
Yeah, I mean, it's been nothing short of amazing. I've grown to, again, love the work that we do here at the Children's Hospital, as well as love everyone that I've been able to interact with and the executives and leaders who have been so kind as to kind of show me the ropes of how healthcare administration works. Again, especially coming from that MPH background where I don't have a lot of formal training necessarily in the healthcare admin space. But it is a rotation-based fellowship. So you get to do up to 6 rotations throughout the year here, about 2 months each. Some of the ones that I've been able to do were in decision support services, clinical services with our strategy team, Office of Diversity, Equity, and Inclusion. And I'm currently in the my rotation with the Office of Innovation and Transformation. And so, again, a wide array of rotations and departments that I've been able to kind of work with during my time here. I've done quite a few different projects. Some of the ones that are ongoing are maintaining our enterprise-wide leadership meetings. So I basically help coordinate and run those meetings with another one of the executives. I do stuff like, gather the materials, make sure that folks are prepared to present. I then take those materials and kind of triage them up to our CEO and COO, have them look over it and do a review. I, take any feedback that they have and relay it to the presenters to make sure that they edit their slides as need be. So those are sort of some ongoing projects that I, continually work on. But speaking to the different departments, I mean, I worked on like kind of analyzing like a pilot that was done in clinical services with our imaging services team. So examining how switching folks from the traditional 8-hour, 5-day-a-week work week to doing 10-hour, 3-day work weeks, how that has impacted folks in that part of the organization and how that may have implications across other clinical areas. That's probably one of the ones I'm most proud of. I was able to also compile a Medi-Cal trends analysis for fiscal years 20 through 23, and ended up presenting that to our chief financial officer, which was a big moment for me. So yeah, I've been able to kind of get my hands on a bunch of different projects all across the organization, which has been really, really cool.
What were the impacts from that work week, the hour change that went on?
Oh, yeah, yeah. So that actually, we found I was able to pull qualitative and quantitative data. So quantitative data was sort of behind the scenes. So I was talking to HR and finding what the turnaround rate has looked like since they did implement that change, what the sick rates are looking like, the time to fill a position after being posted. Now that it says that it's 10 hours instead of 8 hours. So I pulled that part of the data as well as did a qualitative piece as well. So I actually took the time to come up with a standardized questionnaire, and then from there interviewed some of the radiology technicians who were there for the change and folks who got hired on after the change. And so I gathered their qualitative feedback as well and kind of married the two together in a presentation. And from there, we saw that it was overwhelmingly positive. I mean, all of the turnover rates went down, the calling in sick rates went down, time to fill went down as well. And then, that qualitative piece, folks are really loving the extra free time with their family, or to be able to go and get a second job if they want to, kind of mix and match their work schedule to fit their own personal life. Again, just overwhelming positivity across the board.
That is excellent. Good for you on that project. That's really great. And then, so with that other one that you were working on, was there any challenges working with, analytics and financial data? Just because I'm interested in an MPH as well.
Mm-hmm.
How did that kind of unique skill set benefit you in working with, financial data and kind of analytics and things like that?
It was very hard, I'll be honest. And a big piece of that is that was the first rotation I did with the fellowship. And so I was, coming into that very new, fresh-eyed. Like I said, I don't have a formal healthcare admin training. I will say that a data analytics class that I took my first semester of my MPH degree did help me some whenever I was kind of playing around with the data. I was doing it in Excel, whereas we had learned status, so it was a little bit different there. But of course, I've used Excel over the years, so I felt very familiar with the software there. It gave me a nice foundation, but I'll say what really brought me to the place I needed to be was my preceptor. His name's Carl, and he oversees DSS, or Decision Support Services department. And he was phenomenal in working with me and getting me to the place I needed to be. It sort of felt like I was in his little class. I was his own student. He had his whiteboard behind him. We'd have our meeting every week, and he'd say, "Okay, what are your questions for me?" And there I just will kind of shoot off what I have after looking at the data. Like, I don't understand why the numbers are coming up to this. What does this mean? X, Y, Z. And he would always so calmly write it on the board behind him, explain it to me in thorough detail, like ask follow-up questions, make sure I'm understanding and following along with him. So I think having somewhat of a foundation from graduate school, then paired with having a mentor who really wanted me to excel and to learn in that space, helped me to achieve the results that I got.
Nice. That is excellent. Yeah. So it is kind of that on the job, training that really helped you to be able to learn that. And that's so nice that your preceptor was that supportive. Have you faced good support overall during your fellowship?
Absolutely. Yeah. I don't know if it's just working at a pediatric center where folks are just, super friendly, but at CHLA, I've had positive interactions with, quite frankly, everyone that I've spoken with. And that ranges from folks who are team members like myself, PMs or what have you, all the way up to the COO, CEO, other folks in the C-suite. Everybody is super, super supportive, and they're very supportive of the fellowship too. If there's any meetings that I want to attend, or if there's any projects that I feel are of interest to me, I know that I can reach out to folks and they'll do their best to connect me with the right people and connect me into the right spaces I need to be in.
Nice. That's great. And then what has it been like working at a children's hospital? I've never worked for one or experienced what that's like. Is it any different than things you've experienced in the past?
Yeah, it's very wholesome. And just to be quite honest, this is my first like full-time in-person job besides, working in the service industry during undergrad and grad school. So, bearing that in mind, I love working at a children's hospital. I think that they're a lot more playful, obviously, than adult hospitals. I, was used to kind of just walking in and seeing, okay, everything looks very sleek, white, clean, clinical. But you walk into our hospital, it's very colorful. There's interactive toys and games for the children to play with. There's, folks handing out Play-Doh and books to the kids, lots of smiling faces and laughter, beautiful outdoor spaces for the kids to play on the playgrounds and to be able to walk around and just enjoy nature and sunlight. So they're not, always just stuck underneath those, fluorescent lights in the hospital space. So I very much enjoyed getting to kind of be in that atmosphere and to really see our mission statement on the faces of the children and their families and parents who are accompanying them, to their visits.
That's wonderful. That sounds like a really fun place to work.
Oh yeah,
That
I
sounds
love
really
it.
nice. So what has the culture been like in Los Angeles in general? I've never been out, that way before. Like, as you know, I'm from North Carolina. Has that been a nice place to live? Has it, the livability in terms of, the salary and cost of living, and like I said, also the culture. Has that been something that's been nice?
Yeah, it's so funny. I had never been to Los Angeles or California either until I did one of my first administrative fellowship interviews. And, I came to Southern California and I saw it for myself and I thought, wow, I need to be here. Not saying that I will live the rest of my life here, but at least for the next few years, first and foremost, think Southern California is one of the most beautiful places I've ever been. Being able to see palm trees everywhere, driving and seeing the mountainscape. You're able to go to the beach from where we're at in like less than an hour. Just very, very beautiful place to be. But speaking more to the culture here, I've been loving that as well. North Carolina is definitely more calm and slow pace, as I think that a lot of places in the southeast are. So it's kind of fun to go to like a busy, more lively city area. And being here in Los Angeles, again, kind of speaking to my past as somebody who grew into their queerness and being a gay man myself, it's nice to be surrounded by that type of diversity. There's so many other queer folks here in Los Angeles, and not only that, but folks who are like openly themselves and are able to be that way without having any sort of fear is really great to see, and it's been very enlightening for me, and has made me feel even more proud to be a gay person and to be a gay person from where I am. So it's just been really great all around. In terms of cost of living, of course, it's definitely more pricey over here than where I grew up. But thankfully, I'm compensated pretty well with the fellowship, so I'm able to make do. And I live in a house with my partner, and we have a housemate as well. And we're all, really enjoying our time here, trying to build a community with folks, both at CHLA and outside of, the healthcare space as well.
It's wonderful. I'm glad that they're, compensating you well, and then you've been able to, make friends in the area and enjoy it. That's wonderful. I know that, in North Carolina, it's definitely interesting because the cities are one thing, within the city, and then once you're out of the city, it's a drastic change, of
Absolutely.
the culture. And I mean, same thing in here in Philly. It's a nice enclave in Philly.
Mhm.
People are very open. People are usually very, very supportive. And then you get outside of the city, especially when you go further west, and people tend to be a little bit different. So it is very interesting. Yeah.
Yeah, and I do want to clarify too. I know that of course, like there can be judgment and like harshness, like all across the country too. So I know even here in
Yes.
California, you can, drive outside of LA even just like an hour or so, and there's other places where folks aren't as accepting. So I think it's just
Mm.
about finding spaces where you feel like you can be yourself.
That is very, very important. Whether it's race issues, homophobia, whether it's ethnicity like anti-Semitism, things like
Mhm.
that. It seems like it makes it harder, even if the medical community isn't that way. It
Mhm.
seems like it just makes it harder for individuals to access care and to be open about things in general.
Yeah.
How do you feel like we can fix that? Because it seems like you would almost have to change the culture, and you don't really want to have to, change the culture of a community. But at the same time, some of these things need to be adjusted and overcome. How do you
Yeah.
approach that situation?
Absolutely. And it's a tough question that is very complex and has lots of solutions and answers, I think. I think that some of the biggest would definitely be education and
Mm,
literacy around these types of issues. There's a lot of misinformation that goes around these days, unfortunately. A lot of political parties trying to pin American people against each other. Folks who have a lot more in common than they may think, just based on identity politics or what have you.
mhm,
So I think the biggest piece is just kind of that education component, making sure that folks understand, like, hi, like we're a lot, we have a lot more in common than you may think. And, us folks who are working class have a lot more in common than the people at the top who are, profiting off of the work that we do. So I think that there's really that piece to speak to. And, alongside that, I'd also say just like more exposure. I think that a
mm,
lot of people are afraid of the unknown. And so, to them, like, gay people or a gay person may just seem so outlandish or scary because they've never actually communicated with someone who's gay, or they've only seen it on TV, so it feels so far-fetched to them. So I think that kind of pushing people out of their comfort zones, whether that's them leaving their areas to go to places that are more diverse or offer more diversity, or kind of like encouraging people to be themselves in those spaces, I think that that exposure piece is very important as well, because people aren't going to be able to accept what they don't know.
And that's meaningful coming from you specifically because you've seen the spectrum. You've been across the country, you've been around, you know what that exposure and what that education can do in different scenarios. Thank you so
1000.
much for sharing that with us. I really, really appreciate having you on. And the journey that you've been on from North Carolina, I really love seeing it because I'm from the same area. So it's wonderful to see. And thanks for sharing all of your wisdom with us.
Absolutely. Well, thank you so much for the opportunity, Cole. I very much appreciate it.
Of course. Thank you.